Good afternoon and welcome. This is really a great day here at Southern University at New Orleans, and I want to welcome everyone to our Louisiana Department of Health Disparities Grant webinar. Southern University at New Orleans is extremely proud of this partnership with LDH, and it is so much in line with the mission of the institution. We serve students from New Orleans, surrounding areas, the state of Louisiana, as well as out-of-state students, and even international students. As we all know, COVID has caused massive disruption in almost every aspect of our lives. However, SUNO continues to adjust to protect our students, our faculty, and staff. And again, I'm excited to announce that we're the first HBCU in the nation and the first in Louisiana to enroll in Operation Expanded Testing through Affinity Empowerment, Inc. Affinity is a leading provider of the most sophisticated and secure occupational, behavioral, and direct-to-consumer health services. Affinity Empowering provides testing for our faculty, staff, and students, as well as the community free of charge, Monday through Thursday in the University Center here on our campus on the first floor. We've also partnered with the National Guard to provide COVID-19 vaccines every Wednesday to our faculty, staff, students, and the community. And speaking of vaccines, I want to just share with you some important dates. To maintain our commitment to the safety and well-being of the campus community, and consistent with other institutions of higher education, we've instituted vaccine protocols for the upcoming spring 2022 semester. And these are the important dates. Friday, December 3rd, 2021 is the deadline for students to submit an exemption request or letter of dissent. Wednesday, December 8th, 2021 is a deadline for employees to submit proof of COVID-19 vaccination or medical or religious exemptions. And it is important to note, proof of partial vaccination may be submitted by the aforementioned dates. However, proof of full vaccination, first and second shots, must be submitted no later than January 7th, 2022, in order to be in compliance with the Southern University system COVID-19 vaccine protocols. So January 7th is the date to submit proof of full vaccination. Now, this is important for faculty as well as students. Now, students who have not submitted proof of vaccination, an exemption, or a letter of dissent for the spring 22 semester are at risk of having classes dropped, and employees who do not submit proof of vaccination or exemption may face disciplinary actions. So please continue to check our website, emails, and social media accounts for continuous information on submitting your documents. I want to, before I finish my welcome, I want to thank Dr. Clement for his leadership, as well as the faculty of our Division of Natural Sciences for writing and receiving a highly competitive grant as a collaborative effort with the Louisiana Department of Health for the state of Louisiana. This is certainly the kind of research and the kind of outreach activities that Southern University at New Orleans is known for, making a difference in our community. And again, I want to salute the faculty in natural sciences. We are also focusing on expanding enrollment and our student base in the natural sciences to provide a pool of future healthcare workers and professionals. And I'm certain that the interaction that our faculty will continue to have with our students, that they will be encouraged to pursue either graduate study or careers in the healthcare field. So again, thanks to the faculty, and I want to thank everyone for joining us for this webinar this afternoon, and welcome.
Thank you so much, Dr. Amos Jr. You have been our wonderful chancellor, and you have kept us focused on our strategic plan, safety of students. And I always tell students that safety is something you don't get credit for. You can practice it for 100 years, and the one day you make a mistake, you pay dearly for it. So this webinar is focusing on making sure that we take a lot of the things we take for granted into consideration and understand things more, a little bit more as experts in this field. I'll call, at this juncture, I'll call on Dr. Adeboye to give us a presentation and on the overview of the immune response to respiratory infections and vaccination benefits. I will just make 3 short sentences for Dr. Adeboye. He obtained his PhD in microbiology and immunology at Cambridge University. He was the former Vice Chancellor for Academic Affairs, and he has very vast experience and has worked with the National Institutes of Health in Bethesda. So without much ado, Dr. Adeboye, please take the platform and give us some wonderful presentation. Thank you.
Thank you, Dr. Clement. Thank you, Dr. Amos. Let me share my slides. Okay. I'm David Adeboye, as has been said. I will be presenting an overview of the immune response to respiratory infections. Infectious agents that affect the respiratory tract include bacteria, viruses, fungal agents, and so on. However, because of the time we are in, we'll be focusing on COVID-19, which the full name is coronavirus infectious disease 19. Edward Jenner, a British family doctor, became the pioneer of vaccination when around 1796. He made an observation: the world was suffering from smallpox, and he noticed that some milkmaids who had cowpox, which was less severe than the human smallpox, did not have the human smallpox, and he was curious. So one day he took the pustule from one of the ladies that had cowpox, and it was a dangerous thing to do. They would crucify him now if he did that. He injected it into an 8-year-old boy. He scarified it into the lesions, and interestingly, the child developed cowpox which was less severe than smallpox. And other children were dying, were infected with this very disfiguring disease. And when the boy did not develop smallpox, he went further and did his studies, and that was the beginning of vaccination. Over the years, whenever we have pandemic situation of this nature like we are facing, what the world has been doing is to recommend mass vaccination. This is how the world overcame smallpox, polio, measles, and some other infectious agents. Right now, the COVID-19 has become even more problematic. Just last week, a new strain that is known as Omicron variant has just been reported. It is very notorious in the sense that it has up to 30 to 50 mutation spots. And right now, scientists are working very hard to try to understand the potential for diseases arising from some of these mutation sites that are completely new under COVID-19. We are keeping our fingers crossed. The point we are trying to make as scientists is that there are too many dangers around, and we don't know where we are heading. Therefore, as scientists this afternoon, we just want to caution each one of us to pay attention to the science of COVID-19 and the immune response, and do whatever you need to do. Take a decision and see what you need to do. On this slide, I want to explain very briefly the topics I'll be covering. Very briefly, I'll be discussing the anatomy of the human respiratory system. I'll also explain some of the factors that pathogens use to invade that system. I will briefly discuss the host immune response. I wish I have 2 hours. That's my PhD field. And then we'll discuss the value of vaccination. The respiratory system briefly anatomically divided into upper respiratory tract and lower respiratory tract. When infectious agents enter the upper respiratory tract, within the first few days, you'll be running noses. And before you know it, if it's a dangerous organism, like some bacteria are, and of course, like COVID-19 is, before you know it, it has extended into the lower respiratory tract. On this slide, I want to show you what we see under the microscope when we examine a thin section of the respiratory tract from around the nasal, let me say from the pharynx region down into the bronchi. I have been involved in some of the places I've visited in what we call organ culture, trachea organ culture. What we do is slice very, very thin, less than 1 millimeter thick trachea sections and put them inside tissue culture. When you view them, these structures that are known as cilia, this is why we call this ciliated epithelia. It's almost like you are in a factory. Just chew, 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 chew. And this is what they do from the first day of life until the individual dies. And what they are doing is mopping up infectious agents that are trying to fight their way into the lungs. Sometimes they are successful, sometimes they are not. The next slide is where I just want to briefly explain the virulence mechanisms of infectious agents. We are not focusing on bacteria, but I just have to tell you that bacteria are equally very dangerous in this system. We're just very lucky that they do not, they respond very well to antibiotics because on their surfaces, you have sites that antibiotics can hit and kill them. But if you don't make diagnosis on time, they produce all these dangerous materials, toxins, endotoxins, leukocidin, which kills white blood cells, capsules, which prevent them from being engulfed by phagocytic cells. Hyaluronidase is an enzyme they release to disrupt the epithelial cells I just showed you. Many times when they are very bad, such as we have cases of whooping cough, we make effort to develop vaccination for them, against them. Now the topic for today, and I'm going to move faster, are viruses. They are very, very dangerous indeed. They are not living things on their own. They are useless unless they have contact with cells, human or animal cells. They are intracellular. Bacteria are extracellular except the TB organisms that is intracellular. So when viruses enter the body, they use molecules that, this is artistic impression of what their surface look like under scanning electron microscope. These are called spike proteins. And this is what they use to latch to the cells they are attacking. They are resistant to antibiotics because they don't have surfaces that antibiotics can attack. Now they are working very hard to develop drugs that can take care of viral infections once and for all. Until then, our solution is vaccination, or the best approach is vaccination. You don't want to wait until you develop disease before you get ready. The Omicron strain that is around now, we don't know exactly what it's going to do with the world. And if you are not vaccinated, it could be very problematic. Viruses have very complex life cycle. Once they get in contact with our cells, they have 5 major stages. I'll be very brief. Number 1, they must attach. And once they have attached, the second stage is they must enter the cell they are infecting. We call this entry. And the third very important stage is the stage of replication. This is where they are most devilish. They go in, release their genetic material, and latch it onto the cell's genetic material, and command the cell, so to speak, to start replicating their own genome. And after doing this, they move to a structure in the cell known as ribosomes, where proteins are secreted in the body. The ribosomes translate their genome and form what are known as viral proteins. So it cheats by commanding the cell to produce itself, and cheats by making the cell to produce its coverings. And once the coverings have been provided, the fourth stage is the assembly stage. It recreates itself. And from one cell, you could have thousands or millions of cells, or viral virions, as we call them. And at the end, they are released into the body and they infect other cells. We have many cells that participate in the immune system. I wish I have 2 hours, but I have less than 10 minutes. But I mentioned the most important cells. The B cells are responsible for antibody production. I will explain this in the next slide. The T cells, T lymphocytes, are responsible for what is known as cellular immunity, more complex than antibody or humoral immunity. I will try my best to explain what happens at that stage. And then we have a lot of other cells that can work under the command of these 2 cells to try and protect us. The defense system itself, we have 2 major types. one known as non-specific or innate immune response. This is the natural protective mechanism at the port of entry, like in the nasal cavity. It is not dependent on prior exposure to a pathogen. It doesn't matter whether the infectious agent has come in or not. This non-specific innate immune response will always try to protect the individual. So they are the first line of defense. The ciliated epithelial cells I described earlier on play a major role here. And I want to say this might be the most important statement I will make in my presentation. If you have not been vaccinated against COVID-19, this non-specific immune system is what has been protecting you. But you cannot ride on this forever because, oh, you might say, oh, I'm strong, I'm good, I don't party, and so on. You might have survived for the past 15 months, but you never know the time that you just go to a little party or give somebody a ride who might be infected, and you are exposed to a heavy dose of the virus. And that is when the problem can start, because you have nothing protective in you apart from this non-specific immune response. This is why we are encouraging people, think very well. If you have not been vaccinated, the Omicron is coming out. We don't know exactly what it's going to do to the world. So you have to think very well about what you do with vaccination. Now, very quickly, the specific immune system. This is really what is covered in immunology. And there are two types: the antibody-mediated or humoral immunity, and the cell-mediated or cellular immunity. I'll be very brief in trying to explain this. The humoral or antibody-mediated immunity relies on antibody that are secreted against a specific pathogen following natural infection or vaccination. I need to emphasize this, that this humoral immunity and cellular immunity develop following both natural infection and vaccination. You don't want to wait until you develop COVID.
Dr. Adeboye, you have to be rounding up now.
Yes, okay. You don't want to wait until you develop COVID before you try to develop antibody against COVID. This is why we recommend that you get vaccinated. It goes through a very complex process. The B cells, that is the prominent cell in this mechanism, picks the infectious agent, which is, let's use COVID-19 here. It internalizes it, breaks it down into fragments that are still infectious. It cannot kill it on its own. Therefore, it does something. It gives a signal to a group, a particular cell known as CD4 positive helper T cells. And the way it does that is when it presents the antigen on its surface, it projects a molecule known as major histocompatibility complex 2. And when helper T cells see this on the surfaces of B cells, they know that this B cell is carrying a pathogen and it needs our help. So the CD4 positive cells move in, latch onto the B cells and activate them. And once B cells have been activated, two things happen. They develop into cells known as plasma cells, which are equipped to produce antibodies. And this is what we measure when we check patients to see whether the vaccine is working. And very importantly, we have memory B cells that develop. Whenever somebody is fully exposed to the infectious agent, these are the memory B cells that come on. Instead of taking about 1 to 2 weeks to produce antibodies, the memory B cells come along within 1 to 3 days, produce the antibody, and you are protected. This is why vaccination is extremely important.
Thank you very much,
That,
Dr. Adeboye. We have to.
You just give me like 2 minutes more.
No, we have to stop here.
Okay.
Otherwise, we'll eat too much into the time.
Okay.
Thank you so much.
And
I will just continue from where Dr. Adeboye left with the issue of the memory B cells. They are like the spies who make sure, and they go around in the body and make sure that foreign agents like viruses, which are dangerous to us, are correctly tagged and they are taken care of. We will go to the next speaker, and please, we should try to remain within the time because we couldn't spare any time for Dr. Adeboye for question times. And this is Dr. Teasel. Dr. Teasel is a wonderful professor. He has been supporting students in a lot of research, and he will be presenting how to protect yourself, why to wear a face mask. Very simple things, but with very important ramifications. He obtained his PhD in biology and immunology at Johannes Gutenberg University in Mainz, Germany. He's a full professor here. He has worked tirelessly and continues to work tirelessly. Dr. Teasel, please take the platform and give us some wonderful information. Thank you.
Thank you, Dr. Adeboye and Dr. Clement and the Chancellor and the Louisiana Department of Health. So the reason why I have this presentation is because my wife and I, family and friends, were in the same situation, and we asked these questions: how to protect yourself. And one question was, we hear the recommendation to wear a face mask, and I was wondering why, and I tried to explain to my wife why. And so the virus can move through the air and is taken up when people breathe in through the nose and the mouth. So having a mask is a barrier, so the virus cannot get into the body to make the body sick. Epidemiologists call this the portal of entry. Now, if a person is infected, when they breathe out, the virus can leave the body through the nose and the mouth. So having a mask is blocking the exit of the virus. Epidemiology call this and the portal of exit, the route how the virus gets out. Then we had recommendations about the social distancing. What is that about? The background of the science is that the virus, the COVID-19 virus, can float in the air just on dust particles or in droplets, and therefore can get from one person to the next. And you see here a cartoon at the bottom with these two figures, the virus as a red star. And we see here that the virus is floating to the other person. And the further the person is away, the less chance the virus has to get to the next person. So the specialist term talks about airborne transmission and droplet transmission. Then we heard the question that we should wash our hands. And what is that about? So the virus can spread through handshakes, and epidemiologists call this direct contact transmission. And the virus can also spread through surfaces that we touch: elevator buttons, shopping carts, keyboards. So one person is sick, coughs in the hand, and then touches a shopping cart. The next person then picks it up, like number 3, and then they have the virus on the hand, and if they maybe rub their eyes or poke their nose, they can get the virus in there. That is called indirect contact transmission. So those are reasons why hand washing was important to block this way of transmission. Then we heard that indoors is different than outdoors, and why is that? So again, a virus like COVID-19 virus can be released in the air from a person that is sick. And we see here a cartoon of a house. And so in this enclosed room, one person is maybe infected, and whenever they breathe out, they release virus. And after 50 minutes, we see an increase of the virus. And then the other uninfected person can be more easily infected. However, if you are outdoors, there's constant air movement, and by wind or by temperature differences, and therefore the virus in the air is getting diluted or blown away, and therefore it has a hard time to increase enough to infect other people. Then a nurse in my church was asking me, oh, I got the flu vaccine, I should be protected against the COVID-19 vaccine. And that is not true. So a flu vaccine does protect the COVID-19. COVID-19 vaccine does protect against the flu vaccine. Why is that? Vaccines are very, very specific for a very, very specific part of the microbe, whatever makes us sick, actually tiny structures. And for example, the COVID-19 vaccine is against a tiny structure called the spike protein. And this specific spike protein is only on the coronavirus, but not the influenza virus. So the COVID-19 will not work against the flu, and the flu vaccine will not work against COVID-19. So now I'm switching the mindset. I'm talking about the bigger picture, epidemiology. Epidemiology studies outbreaks, in disease outbreaks, and what's happening. And this can help us maybe to understand COVID-19. And one finding was about age groups. In the beginning, it was old people who got sickly most of the time. Then in the summer, it was young adults. And then in summer 2021, this year, it was unvaccinated individuals and kids. Then scientists looked at different ethnic groups, and unfortunately, underrepresented minorities were more affected than other ethnic groups. And again, this is important because here in our SUNO community, we have a lot of students and family members who are belonging to this group. And so we want to make sure that they are protected. So we need to pay special care about that. Then another fact that scientists found out is, well, let's look at those patients who got hospitalized by COVID-19, and do they have any health conditions? And unfortunately, they found out if a person suffers from asthma, hypertension, obesity, diabetes, kidney disease, or a combination. So when they looked at hospitalized patients, there's an overrepresentation of individuals with these conditions. So for me, that gave me an information that I have to be careful if I have one of those conditions, and I do. And my wife has a condition that falls into this pattern too. So now I'm trying to wrap up with 2 more pieces of information. And so this here is a big picture idea. As a scientist, you can try to understand the mechanism of an infectious disease. If you can understand the mechanism, you can also try to stop the infectious disease. And so in the early pages, I explained that a human being could be the place where the virus is living, and the portal of exit is the nose and the mouth. So if we are wearing a mask and washing our hands, we are blocking the portal of exit. We also know that the COVID-19 virus uses the air to infect people, and it could use inanimate objects. So we can make a difference using fresh air, air exchange, air filtration. And again, how the virus can get in, portals of entry, a mask can make a difference, hand washing can make a difference. And then the host, so the healthy person who is the target of the pathogen, we can make a difference by physical distancing or getting a vaccination. So that is the big picture, bringing things together. Now on a personal level, these are the last few slides. How can I look up the situation in my city or my state or my country? And you can look up New Orleans by typing in Power BI COVID-19 dashboard. This is how it looks. For the state, these are the terms. This is how it can look. And for a national level or country level, you can type in this, and this is how it can look. And that's all I have. Any questions?
Yeah, I have a question. Is there data that tells us which parts of the city might have a greater percentage of individuals with COVID-19? Like this, the zip code 70126, where we are now?
I think that is a very good question. Unfortunately, I don't have the answer. And I do know that during the pandemic, different scientists were asking, can we collect these data? If we collect pieces of information, then we know more what's going on. And you're asking a good question about the data of the geological or geographical location, and that would give us some important information. It's a good question, but I don't have the answer.
Any more questions?
I have a question.
Yes.
Hi, I'm Michelle Hall. So the question I have is, I understand that they're doing vaccination for kids now at the age of 5 to 11. Are they considering doing vaccination for infants as well?
I cannot answer that question because I don't have the, I didn't look up this specific question. I'm not sure if someone else has that information, but that would be also good for a second talk. Dr. Clement or Dr. Adegboye?
Yeah, I'd like to chip something into that. There's a study, I think it's from Germany, that shows that the immune system in children are more efficient in combating infectious agents than in older people. And this was why the world was first reluctant in giving vaccine to children. And until then, some children started to have COVID-19 with very severe outcome, but it's believed that some of them are immunocompromised. But for you asking a question about newborn and so on, I have not come across any literature regarding that. We do have a lot of protective immunity, we call it passive immunity, that are passed from mother into newborns. We don't know yet. I have not come across any paper that whether this is happening as far as COVID-19 is concerned. But right now, I support the idea that it's time to be vaccinating children, because I have a friend who is a pediatrician, and he says that when they meet cases of COVID in children, that is very horrible, very, very disheartening indeed.
Thank you, sir.
Thank you, Dr. Adegboye. Are there any more questions? I would just like to add that the vaccination appears to be pushing more towards infants, but care is also being taken to make sure that if you take a baby, basically they get innate immunity from the parent, the mother, that is the first breast milk, the colostrum, and they also get a little bit through the placental surface. And they just want to make sure that if you give a vaccine, there may not be a long-term effect for very, very young children. At any rate, pregnant women are advised to vaccinate. And my clear explanation here is that when something goes into you as the mother, there is an exchange at the placental surface, which is a filter. And so some pregnant women believe that certain things may pass on to their children. That is not the case. So it is very important now to encourage and have pregnant women vaccinate. And any pregnant woman, it is extremely important to encourage that person to get vaccinated. People have beliefs, and we respect all the beliefs. We are not here to judge. We are here to tell everyone that the only tool we have available now to be able to stay alive is vaccinations. If we get more tools, we will have more choices. But as it stands now, it is either the devil or the deep blue sea. So we need to encourage everybody to get vaccinated. I was hoping Dr. Ateya would show up. I haven't heard from him. He was going to tell us something on community immunity and the variants of COVID-19 in New Orleans. He has had some challenges after Ida, so we will jump straight to Dr. Mims Davison. Dr. Mims Davison has a very special presentation. Dr. Mims Davison was formerly the chancellor for SUNO, a wonderful lady. She has worked very, very hard and tirelessly. And she is going to tell us basically some of the real life experiences, her own experiences. She's going to chat with our Dean, Dr. Harrell, and of course, our SGA President, Amber Future, and also our Queen, Ms. Jessica Thomas. Dr. Mims Davison, our beloved Dr. Mims Davison, please, you have the floor and take over from here.
Good afternoon, everyone, and thank you, Dr. Clement, Dr. Teetsel, Dr. Adeboye, Chancellor Ammons, and to all of my colleagues, and most importantly, our students for being here. Because I don't know if you realize, but this is for you and for our community. And so I want to take this opportunity to say, as the old adage says, it truly takes a village to raise not just children, but to raise all of us and to raise our understanding of COVID-19. So what I have done for this part of the presentation and discussion forum is I am speaking with, first and foremost, we have Mr. Tyrone Devizan, who will talk about COVID-19 is real. And he's speaking from a family perspective and his testimony. For most of you, if you recall, at the beginning of the semester, prior to the fall semester, we had one of our students who passed away from COVID-19, Mr. Brandon Devizan. Tyrone Devizan is the grandfather of Brandon Devizan Jr., as well as the father of our alum, Brandon Devizan. And he's going to come to you in his way. We have Dean Evelyn Harrell, Dr. Harrell. She will be talking to you about COVID-19 can affect anyone. There's no such thing as a Black disease or a Black virus, a white virus, a Chinese virus. This is a virus that affects everyone. Some more severely than others. And we know that over the years, especially within communities of color, we have had our perceptions, misconceptions, and our naive theories referencing viruses and diseases, and especially such things as vaccinations and injectable drugs. So Dr. Harrell will speak to you about her adventure and her infection with the COVID-19 vaccine. And to our esteemed ladies, Madam President of the SGA, Amber Fuchsia, and Miss Southern University at New Orleans, Jessica Thomas, they will be speaking to our students especially about the effect that it's up to us. COVID is real. What are we going to do as a community, as a university? What is our destiny? What is our challenge? What are our goals? What is our purpose for speaking up, speaking out about COVID-19 and being vaccinated? And finally, we will have our very own Nurse Cheryl Crosby, who has been on the front line, who is our first responder, and who has been there every step of the way, from surveys to charting out our vaccination strategies and schedules. And before I do anything else, I want to especially thank Nurse Crosby for all that she has done. Many people take for granted the works of others, not knowing all that has to go into this. So Nurse Crosby, thank you as a first responder. So as we begin, I would like to, if Mr. Tyrone Devizan, if you are there, if you would start with sharing your testimony about COVID-19. Okay. Well, we will come back to Mr. Tyrone Devizan when he joins. Next, we have our very own Dean Evelyn Harrell, who's Dean of the College of Arts and Sciences. Dean Harrell, if you would you please share your testimony? And I want to say, when talking to each one of them, I told them, there's no script for this. Speak from your heart. Tell us what you've experienced in your own words. So again, this is unscripted. This is from the heart testimonies. Dean Harrell, the floor is yours.
Thank you, Dr. Devizan. And I also thank our Chancellor. And I will say, I have appreciated all the efforts he has brought to this campus to keep us safe. And I also want to thank, I think I saw Dr. Ford in the audience and other administrative leadership, because just as Dr. Devizan has said, it takes a village. And what I want to leave you with in terms of my story is the importance of the support that we give to each other. Many of you know, if not all of you, that I did endure and survive COVID. When I learned that I had COVID, I was like many people in denial, not me. But I had the symptoms, still in denial. I am a person who works in addiction, so I know about that. But I was so glad that I was encouraged by people, go get yourself tested. And I pursued that. And unfortunately, the story was that I was positive. I remember that day well because it was on a Sunday. And by that time, we were on remote conferences for our church service. And it came at 11 o'clock. And those of you who know about church rituals, I didn't want to answer the phone, but I did. And I found out indeed that I was positive. Saying goes with regard to this kind of news is first you cry. And that's exactly what I did. And at the same time, I was aware of people who had died. So I was also grateful because while I experienced all of the symptoms of COVID, God blessed me to not experience it at the same time. First, I had the difficulty breathing, and it took going through multiple symptoms before my doctor would even agree to have me tested. If you remember the beginning, it was difficult to get a test. And so I had suffered through more than a week of that. But thankfully, in terms of the person I am, because I'm often more concerned about others, the education had come at Southern University at New Orleans before my diagnosis to prepare us for what is COVID. We prepared, we trained. I thank Dr. Johnson, the chair of this natural science department, for hosting training for our faculty to learn how to do remote education. So we were able to survive as a campus, again, that social support, because we helped each other to prepare to be a way to do what Dr. Teasel has suggested is so important to do, to social distance. And so as I was recovering, I couldn't be mad at God for getting the disease. You know, that's why the denial and anger comes, because he spared my life. And that's what we know and hasn't been said. I don't think I've heard it today from this deadly disease. We need to tell that story, that COVID kills. It's not just a disease that we may host. And so I'm thankful to have survived COVID. So I've organized my thoughts to look at what happened before, what happened during. And one person that I want to express gratitude is the person who caregived for me, and that was my husband. It was difficult for him to stay away, but he did in the second bedroom. It had second bed. But in honoring what science has taught us, he did not get the disease, and I'm grateful for that. I also think in terms of the social support that I got, my family, because they're used to coming over, hugging and the like. Friends delivered, I guess what you might call a DoorDash, food, etc., to keep us going. And it takes, again, that kind of love, that kind of respect for what has been explained by our speakers before, the anatomy of this disease. We are blessed to be here today at this campus because we honored that code. And I'm grateful for the researchers that are in this college presenting today to continue to work to bring it to our audience, HBCUs, the students that are here. So the hesitancy, the ambivalence about this disease is this spell such that we embrace the necessity to do what I have learned from health disease education before with AIDS, to respect yourself, protect yourself. So while there's lots of talk about your rights, protect yourself. And I'm not just talking from a context where protecting yourself benefits only you. I'm a social worker, so I know the importance of the micro, the meso, and macro functions. Karen Washington is out there. And so you focus on yourself, but your family as well. And I know I only have a few minutes, so there's much to be said, but I'll say this. Dr. Adeboye said that this is a virus that has a cycle. we see it not just in a single virus, but the variants that have come. So what I want to say is we have to continue this effort to educate and bring awareness to people because there's another variant out there. And we've learned from this what to do. Do you remember the vaccination we got? We have the scars on our arms. Remember the lump of sugar? I remember it because my cousin unfortunately got it. And even as I endured and was able to survive COVID, I had the unfortunate experience, but it taught me something of watching my nephew die, a young person. So Dr. Teasel's information is correct. And it was so sad because he was hospitalized for 8 weeks and I had to watch him die and go through survivor's guilt, someone younger than me, but also grateful that I'm here to assist these scientists with telling a story that's so important for everyone to hear. COVID kills. It kills. So I'm going to end with this. Respect yourself, protect yourself. Thank you.
Thank you so much, Dean Harrell, for your testimony referencing COVID-19. Next, we'll have Madam President of the SGA, Ms. Amber Fuchsia, and Miss Southern University at New Orleans, Ms. Jessica Thomas. I also asked them to speak from their heart, talk about their testimonies, their misconceptions, their perceptions, and what they've done to help Southern University at New Orleans get the word out about COVID-19 to not just the SUNO community, but our community at large. We must always remember that Southern University at New Orleans has been a beacon of light for the greater New Orleans metropolitan area, as well as the state of Louisiana. So again, I ask our two distinct ladies to please come to us in their way and with their stories.
Good afternoon, everyone. My name is Amber Fouché, and I am the SGA president of Southern University at New Orleans.
Good afternoon, everyone. I'm Jessica Thomas, and I'm the 62nd Miss Southern University at New Orleans. It is such an honor and a privilege today to be asked to speak to everyone. I'm very grateful for the opportunity. And just speaking on my COVID experience, my mom and my sister, they did catch the virus. And it was at first, since like we didn't know too much about the virus and everything, seeing my mom go through that, and she'll be at home, like she was sick for about a week and she was crying like every day because she was saying how much pain she was in and she couldn't eat and she just felt so terrible. And she just like, we would all be praying. And my sister caught it maybe 2 months later, and she was in her apartment in Lafayette. So we weren't able to visit her or see her, especially because we were quarantining. So she was out there by herself. So just like having people that you love and care about go through that, it was very hard. So thank y'all for letting us be here to share it. Also about the vaccine, my dad is a pastor, so we did use our church as a vaccination site for about 4 weeks straight. We would let people come and get their vaccines and come and get their second dose. So I was grateful to be a part of that and spreading that in our community and having people have the opportunity to be able to get the vaccine if they wanted to without having to make an appointment at CVS or Walgreens, or because in that time it was really hard to get an appointment or even for people to go out. So yes.
So my experience with COVID, I actually caught COVID-19 in the height of it all. I was really, really sick for about 2 to 3 weeks. I couldn't move. I couldn't eat. I was hallucinating. I would wake up in pools and pools of sweat every day. It was really hard for me to continue with my schoolwork, but I still did it. My mom had to stay away from me. At this point, I think I was living away from my parents. So I didn't really have anybody there with me, but because my parents and my family were so scared to come around me. So I was in the house by myself for most of the time. And my sister, she lived with me as well. And I had to close her off in another room. She didn't end up catching it at all. She was pretty safe. But I spent those weeks by myself, and it was really, really hard. And when they came out with the vaccine, I was skeptical.
Amber, you are muted.
Amber,
I'm sorry, I've been
your
talking for a
mic
long
is-
time. So I caught COVID at the height of COVID-19, and it was really hard to go through. I was by myself. I wasn't with my parents. My mom would drop food off, but she wouldn't come in. She would leave it at the stairs, and she would go on about her business. My sister was with me as well, and I was trying to block us all so she wouldn't catch it. She didn't end up catching it at that time. I think she did catch it a little after me, but it was really hard because we're locked up. Couldn't really go anywhere. Everybody was scared to come around me. I was pretty much by myself for a while until I started to feel better. I couldn't eat. I couldn't really sleep most of the times. And when I did sleep, I would hallucinate. My fevers were really, really high. I didn't go to the doctor. I don't know why. I didn't think I had COVID. I didn't want to believe. That's why I didn't go to the doctor. But then my mom, she was scared one day, and she just ended up bringing me to the hospital. And she's like, yeah, you have to get up. Because I was in the bed for like about 2 weeks. It was 2 weeks of just nothing, hurting, crying, everything else. I was really scared. And then once the vaccine came out, I didn't get the vaccine because I was scared of the vaccine as well. Until another family member contracted it. And then I had my peers at school that were, telling me about it more and giving me more information every day. And I had a few chats with Dr. Ammons, and he would update me and things like that. And he'd say, hey, I know that this is your choice, and I want you to look it up and research everything. And then you come back and you let me know what you're thinking. And I think right before we started doing our coordinations and things, I got vaccinated. I got my first dose. And I felt really great about that because now I feel like I'm helping other people instead of me putting other people at risk of getting COVID-19, even though, I'm young. So I'm like, oh, well, maybe I won't catch it, but I can still be passing it on to other people. I could be asymptomatic. So I felt really good about getting the shot once I did get it. And then once I got the second dose. So I did go through a bad time with the vaccine though. I was, just a few hours after, I just was sweating really bad, but that was the only thing that happened, nothing else. Everything else was fine, and I felt fine ever since. But I was really scared to get it, but I will say, get vaccinated. It helps a lot of people, and it saves a lot of lives.
Thank you so much. Miss SUNO, you were getting ready to say something?
Yes, ma'am. Dr. Chazon asked us to tell us the experience of students. I also work in the housing office. So I was able to see firsthand a lot of the students that had to move home, and either they had to come back with negative COVID tests every 2 weeks or either go get vaccinated and show their vaccination results. So with a lot of the students, some of them were very skeptical with even taking a test or getting the vaccine. So like with Amber and I and most of the people in the SGA, we're like a voice for the students, like kind of telling them, the positives of it instead of them hearing so much negative from social media, because instead of them researching it on their own, they were going to Twitter, Instagram, and just whatever they would see, they would use that as feedback, and that would play a part in their decision in getting the vaccine. So that was one thing with the students. And then I know the administration enabled the Fly Wednesdays where they had the COVID testing and the vaccination site. So I guess that helped us a lot, especially in the beginning. We had the raffle with the Apple Watch and the meal plan. So I think those incentives help the students, not just because they want an Apple Watch, but because they see it's a great opportunity and they see that they're keeping their peers safe and their family also.
Ladies, if there is one final statement that you would make to your peers, to our students, to our family, what would be your final word to empower our students about the importance of the COVID-19 vaccination and the final decision being up to us to get this virus under control? Your parting words.
I would just like to say that prevention works. That's what this has been about. Knowledge is power. Today, we have been made aware of information that can't do anything but help us, help our families, and help our communities. So wash and wear. Wash your hands, wear your mask, and social distance. Thank you.
I think I would say to continue to stay educated and keep yourself well informed. And also don't leave your life in the hands of social media.
Ms. SUNO.
Yes, I would say that just continue to be safe, continue to be smart about everything, continue to do your research. Because I know in the spring, we're going to be in person and, you know, you have to be vaccinated. And I don't want everyone to feel like they're forced into the decision, but I want them to have an informed decision and know what they're getting themselves into.
We will have Nurse Crosby to make comments as a first responder and to share her story about all that she has done to ensure that the Southern University at New Orleans community, as well as our surrounding community, remains safe, aware, and receives those vaccinations as life-saving measures from COVID-19. Nurse Crosby.
Good evening, everyone. How are you?
Good.
That's good. I'm glad to see everyone. Well, as a nurse, it's been difficult, it's been rough, but I mean, we got through it with the temperatures early in the morning, making sure everybody had a mask on, making sure everybody was there. When we knew somebody was missing, we were like, okay, did you see so-and-so this morning? You know, just checking in on everybody to make sure everybody was okay and everybody was feeling all right. Actually, I didn't look at it too much as a difficulty from a responder's point of view, but actually from a family type of view. The same things that I would tell my family, I would tell staff, faculty, and students. As a matter of fact, I'm still preaching to the students to, you know, get the vaccine. I've done some surveys for Dr. Clemon, and when you look over some of the surveys and you see the remarks that the students make, it's they don't trust it. They don't trust the vaccine. It's too quick. They just don't want to take it. Some of them have no reason at all. It's amazing how they would rather get tested every week than to get the vaccine to help them be safe. Like I told them, the vaccine not only helps you, but it helps other people around you. When you go home for the holidays, you go home to your families. You don't know if your family is carrying or if you have it and passing it on to them. And it's a hard thing to watch a family member laying in a hospital that's dying, taking their last breath. And the only way you can say goodbye or say I love you is if a nurse has the time to FaceTime somebody so you can talk to them. And you try to hit home with that because it's hard to just see it and watch it. I mean, we lived it. We had one of our employees, you know, we saw him one day and the next day we heard he was in the hospital and the next thing you know, he was gone. And, you know, we're kind of like a family around here. We all stick together. We might argue sometimes and we might fuss sometimes, but still, all in all, we're still family. And the importance of taking the vaccine, I can never not tell you that how important it is to take the vaccine. It really is. When I first heard about it, I was like, I don't think I'm gonna be doing that, you know, and stuff like that. But after a while, when you think about it, it's the best that you can do, not just to help yourself, but to help other people. And I strongly believe that if you don't take the vaccine, that you're being selfish, because where you may be asymptomatic, don't have anything or whatever, that person that you're sitting next to or your little, or their little brother or sister or whatever, is clinging to the fact that, you know, you could bring something home to them. I have, my little granddaughter is 8 years old and she tested positive for COVID. That was the hardest thing in the world for me because she's only 8 years old and I'm like, you know, this just can't be real. But thank God she survived, she's doing okay. And, but that's a hard pill to swallow, to watch an 8-year-old, I mean, hurting, and she has asthma and all of this stuff started acting up and she was, so, you know, it's, if you're not taking the vaccine, you're being selfish. And that's a hard way to, that's a hard way to be. But we still tell that story about taking the vaccine and how important it is and doing the injections, getting your shots and everything. The incentives have been great, especially that $100 shot, that $100 shot. It really brought a good bit of them in, not just from our school, our campus, but from all around our community. And now to see that the younger kids are coming in to get the vaccine, it's just, it's heartwarming to see that, you know, some of the kids want to come in and the parents don't want to take it, you know, but after they see their kids sit there and take it, they were like, well, I can do this, you know, and, you know, you just talk to some of them to alleviate their fears. And tell them the truth, tell them what's going on. If you don't, there is a chance that you can wind up in the hospital, or you can die, or give it to somebody else who's not as strong, immune system is not as strong as yours. And you can, you know, the next thing you know, they're gone. So my advice to everybody is get vaccinated. It's good to get tested, but the best thing that you can do is get vaccinated. I always tell the students around here, I would never do anything. I would never ask them to do anything that I wouldn't do. And I've had all 3 of my shots. So my best advice is to just keep pushing it to them and keep telling it to them until they get it. So it's been a joy. It's been a kick. Everybody remembers those temperatures in the morning time. Then when I left, everybody was like, well, where's she at? Nobody's taking temperatures. So it was nice. It was nice to see everybody and nice to see everybody feeling good and healthy and stuff like that. So you guys keep doing what you're doing. Wear your mask, stay at 6 feet, 6 feet, and wash your hands. And keep telling the next person, just ask them, you're vaccinated? Are you vaccinated? You know, so, and keep on pressing on and keep on doing your surveys, Dr. Clement. So they must be working. So with that, everybody, I guess I'm about through. I guess as nurses, we still say the same thing over and over, you know, get vaccinated, stay healthy. That's about it for me, y'all.
And Nurse Crosby, once again, thank you, because what people don't realize is first responders being on that line, they too, as they give the information out, but they too can take this very serious and dangerous virus home to their families and spread the virus as well. Again, as I stated earlier, this virus knows no name, no color, no barriers. It affects any and all once it invades. So together, we can make a difference just by empowering one another, spreading the word as we've done. Tell our story. Our testimony is what those individuals who may not understand or know the severity of this deadly virus and the variants, this is what they need to hear. And true, we may not reach everyone, but if we can save at least one, then truly, as the song says, our living shall not be in vain.
We are waiting for Dr. Ford also. I can see him.
I'm here. I unfroze.
Okay, you're unfrozen. Okay. So we'll turn it over to Dr. Ford.
Thank you. Well, I was supposed to give a greeting, but it's kind of odd giving a greeting at the end. So I just want to kind of share a little information on my thoughts around COVID and higher ed. So, and part of it is also because of my background with my PhD being in biomedical science with the focus in anatomy. So when the virus first happened, I was aware how viruses worked. I told people very early on, this wasn't something that was going to go away tomorrow. This was something that was going to be around for years. So my thought was around planning for that. So I had to really make some difficult decisions, but really it was in the best interest of everyone. So even though it didn't start here, it's carrying over here. But the first thing I realized is at some point we were going to emerge from this virus and life was going to have to go on. So one of my focuses has always been learning must continue. Our students must learn. We as the faculty, staff, administration had to make the sacrifice to be available, to be around, and to be there for the students to make sure learning continued. Because at the end of this, our students were going to still have an expectation of being competitive in the workplace. I knew the world was going to change. I knew that technology was going to be a driver moving forward. So I really took a focus on those areas around technology, but at the same time, we knew that there was going to be a need for social services. So as they were here putting together a nursing program and strengthening their social work program, I was actually building a nursing program and a social work program with a master's degree in Fort Valley, where I came from. And I say it to say, I will continue on that same mission, that we're not out of COVID yet. And in New Orleans, we're in even more of a unique situation because We have storms that are going to be part of what we do. So life is going to always be in transition for us, even after we come on the other side of COVID. So that's why I've worked with faculty, and faculty are making sure that they can do instruction in multiple modes. So faculty are now doing in person. At the same time, they have those classes prepared to do hybrid and fully online, so that we can make sure learning continues. Because at the end of the day, that's what you all are here for, to learn. And we're here to share knowledge, because I don't think any of us are here for the size of our paychecks. We're here because of the size of our hearts, and we want to continue to be here. So we're going to continue to push students, even when students don't feel like they want to be pushed, because we know what you're going to need on the other side, and we want to make sure that you're successful when we get past this pandemic. So I want to thank the faculty, staff, guests, and everyone also that's come out, and thank you for this opportunity to greet you.
We always say that we save the best for the last. And Dr. Ford has really hit the nail on the head. And he has such an embracing way, because we have very difficult situations. We contact him and quickly he finds a solution. So that is why I wanted him to come at the end of it and then tell us how we need to go forward. Thank you so much, Dr. Ford. This is a wonderful time, and hopefully we are pushing ahead and things are getting better and better. Is Dr. Hilton here? So Mr. Davison has had some problems, but it's part of life. What we go through every day is part of life. And there is an old African saying that when the people start putting the food in the plate, it is being shared. So it is not a time to sit back and say that there will be another time to do this thing. We are doing it now, and we are having challenges, but I'm sure that we will be able to overcome the challenges, and we will be able to learn new techniques which would allow us to keep our students in school, continue with life, get even better. At this juncture, I would like to give 1 minute to Dr. Adeboye to say something, Dr. Teasel to say something, Dr. Mims Davison to say something, and then we'll round up. And for all the attendees and every participant, I will say a big thank you. I've been looking at chat, and a lot of community activity is going on there. And we'll be having more of it. So, Dr. Adeboye, final word.
Thank you very much, Dr. Clement. I had posed 2 questions in my PowerPoint, which we were not able to view. The first question is, if here you are, over 15 months ago, COVID has been disturbing the world, and you've been healthy, you've not taken the vaccine, and you feel good, I'm good, I'm good. And I want to say this, I want to repeat this, that it's not a safe life to live. You should consider yourself joining the group that have received the vaccine and have contributed to what is known as the herd immunity. Almost 70%, around that now in Louisiana, have been vaccinated, and they have contributed to reduction of the disease in the state of Louisiana. So don't wait until the unknown from Omicron hits us to get vaccinated. The second and final thing is this: you have had COVID-19, a serious one. Thank God you are alive. Do you need to be vaccinated? I believe a lot of people have this question. I have, the way I want to answer this is this. There's a study from Israel that shows that people who recover from the natural disease tend to have a stronger immune response, about 13 times more than the immunity generated by vaccine. So that is very helpful. And I understand how that could be, because the cell-mediated immunity that we did not have time to discuss and the humoral immunity all combined, the individual has responded to the whole antigen when you respond, when you recover from the disease. So your immunity is stronger. So do you need to get vaccinated? My opinion, and again, this is debatable, I've been following things up. My opinion is yes. I will still go in and take the vaccine and get immunized, if you want to put it that way. Whatever you can do to build up your protective immunity, whether via vaccination or via cell-mediated immunity, please go for it, because there are still so many unknowns out there. If you listen to the experts from CDC and the NIH, you just have to be as ready as you can. You can't go wrong doing that. Thank you.
Thank you, Dr. DeBoy. At this stage, Dr. Hilton, if you can push in a few words, you've been working very hard with students.
Sure. Good late afternoon to each of my colleagues, friends, faculty, staff here at the university. Thanks to each of you that presented today. In reference to students, our student leaders are vaccinated. SGA President, Ms. SUNO of the Royal Court, a significant number of our students in housing as well are vaccinated, as well as the goal is to push, as Dr. Ammons noted earlier, for all students to be vaccinated for spring 2022. As we know, students can file for exemption. So students can file for exemption based on religious item that they can be exempt, as well as due to health, or students can write a letter, of course. So we're working out all the details in reference to students that draft their letters, who will review that. However, formal information will come to all faculty, all staff. I am from Miami-Dade County, Florida, which is a hotspot for COVID. I've had 3 family members pass from COVID. 2 family members died actually last month, 2 cousins and 1 last summer. So my family has been adversely impacted by COVID-19 and of course the Delta variant just as of last month. So for those that are not vaccinated, we here at Southern University at New Orleans, as well as the Southern University system, hope that all will get vaccinated and follow social distancing protocols. But thank you to Dr. Clement and each of the faculty, as well as distinguished speakers here today for doing this for our university community. We truly are indebted to each of you.
Thank you, Dr. Hilton. Dr. Hilton is the first responder with students, always working closely with students, and that is a very tough job. So thank you so much, Dr. Hilton. You've shared something very important. Dr. Teasel.
I want to thank everyone who shared their personal experience. That is a very brave thing. It's also very humbling. For me, this year personally, I grew through pain. So sometimes personal growth comes through pain. 2 things I also learned is that you never know where help is coming from. And the other thing is education is important also, because you never know when you need it. And it was very helpful to have some education about viruses and microbiology for me and for my beloved ones, so I can explain how to protect them. But we never know what's coming next, and there's someone else who is educated and an expert. So for a student, it's very important that they receive education. You are learning how to think, and this critical thinking, that you can access information and you can evaluate if the information is useful, or if there is a problem with the quality of the information. That is a lifelong skill that you can benefit from. So education is very important. Thank you.
Thank you, Dr. Teasel. May we have a final word with Dr. Mims Davison?
Dr. Clement, I believe we now have Mr. Devizan with audio. So I would like to yield to him so that he could close out with the final story that would or should perhaps hit home about the importance of the SUNO community sticking together and why it's important that we all spread the word. We all have a stake in this. This is not just a Dr. Clement, or Dr. Teasel, or Dr. Adeboye, or Dr. Mims Devizan show, or Dr. Ammons, or Hilton, or Dr. Ford. This is a Southern University at New Orleans united front. And we stand together in our efforts to combat this very serious virus, as well as the variants. So, Mr. Devizan, if you're there, if you could bring us home with your testimony about how COVID-19 has affected your family. Good evening. You may have to, are you muted? You may have to unmute.
So we would like to bring a close. Mr. Davison would have an opportunity again.
Yes,
because
we will have another opportunity.
Yes, we want to thank everybody who has taken time off to attend this webinar, very useful webinar. We thank the Chancellor. He has been very instrumental and has done it in a family man way, which has given a lot of confidence to students. And Dr. Gregory Ford and Dr. Hilton, because they have worked very, very adeptly at making sure that students are comfortable on campus and work goes on. And that is how life is. We have to live. And I also want to thank Dr. Adeboye so much because he had this idea of this health disparities grant. He worked hard with Miss Evis Richards of the Louisiana Department of Health and has been a very quiet but strong arm behind to make sure that things go on and we get the best on campus here for our students. And that is very much to be appreciated. It's hard work, it's difficult work, and we are all one fighting this big, big challenge. And I will only end with one thing. I watched a movie about a virus turning people into vampires, basically. And I laughed until the last time COVID hit, and I looked at the streets and they were as empty as the movies, and I was just shivering. So we have to work hard. Every little light that is on to preserve humanity, we have to help to keep it lighted. So thank you, everybody. Thank you, everyone who participated. Thank you, colleagues. We are all one. We want to work hard to stay alive. And it is a pleasure and a heartfelt thank you that you have taken time off to be able to support us. And thank you to Dr. Adeboye once more, Dr. Teasel, Dr. Mims Davison coordinating for Ms. Amber Fucha, Jessica Thomas, and Ness Crosby, our dear Ness Crosby. Thank you so much and have a wonderful evening. Bye-bye.